Steve Biko Academic Hospital has opened the Paediatric Neurology Rehabilitation Unit in partnership with the University of Pretoria and the Gauteng Health Department. Now, the facility caters for clients who have neurological or spinal cord injuries, as well as traumatic amputations. It will also treat patients with visual impairments. Now, President Ramaphosa has called the hospital a model for public health and a blueprint for the NHI's future. We speak now to the head of neurosurgery at Steve Biko Academic Hospital, Professor Llewellyn Padayachy. Good morning. Welcome to Newzroom Afrika and congratulations.
Good morning. Thank you very much.
Yeah, this is on the back of a lot of hard work that you all have been doing at the Steve Biko Academic Hospital. Firstly, tell us about your center and the kinds of medical services that you provide.
Thank you so much. So like you said, and I think that's the most important thing, is a lot of work over quite a bit of time involving, lots of different people. So I think to start off with, it's an acknowledgement of the team involved. So there are two components to this. The one is our Brain Tumor and Translational Neuroscience Center, which is a university-driven entity that is housed in Steve Biko. And the other one that you picked up on so astutely is the African Pediatric Neurosurgery section. So my main passion in life is pediatric neurosurgery and really the treatment of brain tumors in children. And these two, the section and the center, kind of converge around those as a focal point, really to improve the outcome in all its spheres for children with brain tumors.
And if you can, for our viewers, paint a picture of the kinds of medical conditions of the patients, the young patients in this case, that you deal with.
So I'm going to focus on children with brain tumors. It's been a sort of cause that we've embarked on as a team, like I've said, for many years now. And the one stark thing, or the one consistent finding that we've had, is that whenever these children present to us, it's much later than they should have. So as a surgeon, obviously, we want to remove these tumors as safely as possible, give these kids, and adults for that matter. Remember, our center also treats adults with brain tumors, right? But we want to remove them, and we've introduced numerous safety mechanisms. So our main goal is, safe neurosurgery above all else, right? So we image intraoperatively, we monitor neurophysiologically, we use navigation, we use minimally invasive tools as best we can. But every single time, particularly in children, even though we're able to remove these tumors and they do well, the best prognosticator or predictor of outcome is early detection. So we have to be able to pick these cases up early in order to improve the diagnosis.
And I want to come back to early detection, because I think, for the many viewers that are watching, there might be something that you say that could assist parents to bring kids in early before it's too late. Now, when it comes to the numbers, let's talk about the numbers and your capacity. What is the prevalence of children with tumors that come to the Steve Biko Hospital?
Yeah, so that really touches on the nerve, if you like, of the whole subject, right? So we childhood brain tumors are really underestimated or underappreciated in terms of the prevalence. So they're the second commonest cancer in children, and the most common solid tumor or cancer in children. So it's not like, it's that insignificant in terms of numbers. At Steve Biko, and we built a relationship with the Nelson Mandela Children's Hospital as well, obviously because of the pediatric neurosurgery component, the volume of tumors that we treat now have become more. And I hope that's a reflection of the fact that, patients march with their feet, right? So if your outcomes are better, or you're putting more of an effort into improving the system. And let me acknowledge the constraints within a public health system as well. I don't want it to appear as though things move smoothly. We have our limitations, but I think the effort or the will to try and find a way to make that work is perhaps reflected in the increased volumes of tumor referrals that we've been seeing.
Now, the president has called the Steve Biko Academic Hospital a model to be replicated across the country. So what should be the key focus areas in the process of replicating your model?
In fairness, and we were really thankful and appreciated the president's visit, and he came for specifically to highlight some of the kind of benefits that the hospital has provided, and particularly the nuclear medicine infrastructure, which is just a world-class facility headed by Professor Mike Satechi. You know, if you look at that sort of model, if we could look at combining that approach, and we have to make the point, Mr. Chaba, that, you know, it's not in isolation, you know, public sector. We have to find ways of collaborating, not just transdisciplinary, but trans-sector. You know, finding ways to bring private sector investment in so that we could build this together. Very much, you know, the model that you were speaking about previously. But I think to find a way to rescue, or at least to continue to support the system, we have to find novel ways to drive it forward.
Well, Professor, we commend you and we thank you so much. God bless doctors, honestly. Thank you so much for your time.
Thanks, Miss.
All right, that was the head of neurosurgery at the Steve Biko Academic Hospital.